Hello, Dr. Fanta. Thanks for your time to do an interview with me today. My name is Kirsta Kim from Boston Trinity Academy. I have been a volunteer at Partners Health Center at Brigham and Women's Hospital. I would like to ask some questions to you about asthma. So please tell me about yourself and your history as an asthma doctor in Brigham and Women's Hospital and Harvard Medical School. What do you love about your job?
Oh, Carissa, thank you, and thanks for this chance to talk about asthma with you. And I've been a doctor at the Brigham and Women's Hospital forever. I came here as a medical student many years ago as part of my training, and then after medical school comes the internship and the residency, and I did that here. It was then called the Peter Bent Brigham Hospital, but it's right here where we are now. Mm-hmm. And then I wanted to become a lung doctor, so I had to do a training in pulmonary medicine, and I decided I would do it here at the Peter Bent Brigham Hospital, and I did that. And then about 35 years ago, I joined the faculty here in the pulmonary, and it's called Pulmonary and Critical Care Medicine Division at the Brigham. I've been here ever since. This is my medical home. It's where I grew up, it's where I stayed, and it's been just such a big part of my life. And there are many lung diseases that are treated here at our group treats, but my particular interest has been asthma. I think largely because the people I held as role models when I was in my training, they did asthma care, and I wanted to be like them, and I found it interesting, and so my particular area within pulmonary medicine has been an interest in asthma. And here at the Brigham, there's a lot of exciting research, and many of the doctors spend their time focused on creating new knowledge and discoveries and helping to develop new treatments. And my interest has been particularly, however, the care of patients with asthma, about treatment, about teaching and education. And so
teaching them about asthma.
And in particular about asthma, that's exactly right. And so that's been my focus, has been to develop an asthma center where doctors could come together and not only develop new ideas about asthma through their research, but also focus on the best possible care for the patients with asthma, and then teaching patients and other providers, other doctors and nurses and others too, how to help people with asthma deal with their disease. And I think that's been my focus.
You've come a long way.
Well, I'm gotten old, yeah, that's exactly right. For a long time, that's exactly right.
As you mentioned, you're a medical doctor and director of Partner Asthma Center. What exactly does Partner Asthma Center do?
So this asthma center began just a little over 25 years ago with this idea that we could bring together specialists in the care of asthma. So that would be the lung doctors, the pulmonologists, and the allergy doctors, because asthma and allergy are closely related, and the allergy doctors with expertise in asthma care. And they would work together, they would collaborate, allergy and pulmonary together in the care of asthma. And it started here at Brigham and Women's Hospital. But with the development of this network of hospitals that is called Partners, the Asthma Center also grew to include the Massachusetts General Hospital, North Shore Medical Center, Newton Wellesley, Faulkner Hospital, a group of hospitals, and the allergists and pulmonary specialists there, all coming together in this sort of collaboration, this loose network of specialists who are researchers, who are teachers, who take care of patients with asthma, practitioners, and that we would share ideas and share our expertise and work together. With no reason that we would compete, even though we're in different specialties, different hospitals, we could all work together in a shared effort. And that was the idea behind and the motivating force for this asthma center. the best possible care for asthma, development of new ideas for asthma, sharing this information with others.
As you mentioned, the social network, I know Partner Asthma Center is focusing on social network as well. As the social network is so popular, I think that the asthma social network could be very helpful resources to the patient, especially for the younger generation. How does Partner Asthma Center support the asthma social network and online resources?
We're beginning to develop our materials. So for many years we've had a website, the Partners Asthma Center website, which happens to be www.asthma.partners.org. And so the beginning of our online media development was the creation of this website that has a whole host of useful information about asthma for patients, for providers. One of the things that our asthma center does is hold series of lectures, specialists thinking about asthma, what's new in asthma. And we've created videos of those and saved them in a library online that people can go to look at. Physicians primarily can look at these very exciting, up-to-date information about asthma. So it's multimedia website, and that's how I think we've begun our interest in social media. We have an asthma blog as well. We have an online asthma educators course that people can enroll in and take a series of video lectures and then questions about it, like an exam about it, and work to not only get continuing education credit for doing this online program, but also prepare themselves if they're interested in being certified asthma educators. So it's a preparation for this examination that they're asked to take. And we're working now to go even in new areas of development. One of the ideas that we're trying to develop is the asthma app. You can imagine the opportunity to download a useful resource on your mobile phone that would provide some of this information, but not having to go to the websites, and that's in development. And then the other is focused on asthma in our inner cities. You may know that for many people, living in the inner city is a challenge in and of itself. Living in poverty in the inner city in particular, and asthma is quite common in that population. And developing the resources and providing care for this group of patients who have such challenges in the care of their asthma, that's been one of our interests of late, and we're in the process of developing a collaborative that brings together asthma educators at the community health centers throughout the state of Massachusetts, so that they can work together, so that the bright idea that someone practicing in Worcester has that would be very useful for their patients under these circumstances with asthma can be shared with someone who's in Lowell, and someone who's in Springfield, and someone who's in Boston, and it would bring together these asthma educators at community health centers in a social network and interactive place where there are resources available for all, and that's an ongoing project.
And that's how patients will get to know about asthma, not only the patient, but also people who don't know much about asthma.
I'm hoping that's exactly right.
And now the society, like, they care more about phones. And
I know we get so much of our information on the go now, right? From our phone as much as from
it's like an immediate
desktop.
action.
Exactly, immediate access.
I would like to ask more details about asthma. What is asthma and what are the causes of asthma?
You would think that with this interest of mine in asthma, that I would be able to tell you very quickly what is asthma, and yet it's not so easy. So let me just say what we know, and I think what we know is that asthma is a disease of the bronchial tubes, those air tubes that bring air in and out of the lungs to deep into the substance of the lungs, the air sacs. So these bronchial tubes, the air passages, they can narrow in kind of two ways. One is that the muscles surrounding the tubes can tighten like a boa constrictor, squeezing down on these tubes and narrowing them to make it hard to get the air in and out through those tubes. And then the tubes themselves can get swollen, inflamed, irritated, filled with mucus and swelling and stuff. And that would narrow the passageway as well for the air as the walls get thickened and swollen. And so those two processes of the air tubes make it hard to breathe. It's hard to get the air in and out. Sometimes the air whistles as it goes through, and it's a wheezing sound. It makes you feel tight in the chest and often cough. So anyone who has asthma knows what's asthma. It's cough, it's wheeze, it's tightness, it's shortness of breath. That characteristically comes and goes, because the tubes may, at one point, the breathing tubes may be wide open and the breathing is fine, and in another moment they're all swollen and tightened and it's hard to breathe in and out. So a disease of the bronchial tubes that comes and goes, that's what's characteristic. But unique and special about asthma, and an important concept, is that that susceptibility of these tubes, the twitchiness, the propensity, the tendency to narrow and swell, is there all the time. So the symptoms may come and go. The tightening, the narrowing may come and go. But even when the tubes are wide open, every day people with asthma have that vulnerability. The tubes, if given the right circumstance, around something you're allergic to, exercise and it's very cold out, catch a viral respiratory infection, something sets it off. So the tubes are just waiting for the right stimulus, and boom, now they're narrow and tight again. And that tendency is there all the time. And what causes that tendency, I don't think we know for sure. It's closely linked with allergy. That's kind of interesting. So people with spring and fall allergies, the eyes, the nose, the sneezing, hay fever, that sort of thing, often have asthma. People with allergic eczema, their skin itchy, dry, scaly sometimes, that's allergies sometimes of the skin, and they often also have asthma. So they seem to run together. These food allergies in children often run together with asthma. And so in some sense, often for children, asthma is allergy of the bronchial tubes. And in part that allergic type reaction makes those bronchial tubes so twitchy, so vulnerable, gives them that propensity to go into spasm and narrow intermittently. So some of this is allergy related, allergy of the bronchial tubes. But some people with asthma don't have allergy. Mm-hmm. And so there are other things going on. There are other processes. There are other mechanisms that lead these bronchial tubes to have this tendency. Some is probably genetic. You're born with the genes that leave these tubes with that sensitivity. And other things we don't know. Even now, there's lots to learn about what can bring on this curious tendency of the bronchial tubes that we call asthma.
And even though it's complicated, why is asthma so common, and how many people in America have asthma in general?
It is very common, isn't it? And most asthma begins in childhood, so a lot of children have it, and then many don't outgrow it, so even more adults than children have asthma, and they say it's about 8 or 9% of all people in the United States have asthma. So we're talking 22 million or something like that. It is very, very common. And I don't know why it's so common. It's much more common than it used to be. Allergies and asthma in general have become more common in the United States and in many parts of the world. And it's interesting, it's particularly in industrialized, urbanized, westernized parts of the world, much less in farming communities and rural communities. And what is it about our modern lifestyle that somehow has led to this propensity to asthma? We don't know. It's not air pollution. That would be easy, and that is sort of one's inclination. You say, oh, you're in big cities and it must be air pollution, but it's not that simple. Air pollution isn't good for asthma or the bronchial tubes, but that's not the story. It's something else having to do with the immune system in some way. And it's to be determined what exactly. There's a lot of interesting theories. People are working on it, and because as soon as we figure out what's driving it, we'll figure out how to prevent it. The primary prevention of asthma. What do we need to do in very young children with an allergic tendency so they don't go on to develop asthma? That's coming, I believe, in my lifetime, God willing, certainly in your lifetime, but we don't know yet.
What are the symptoms of asthma?
Symptoms really for people who have lived with this are when it's active. You know, some people with asthma have no symptoms. They're athletic, they're running, they're football stars, they're track stars and swimming stars. They're free of symptoms. But when it comes, when those bronchial tubes narrow, people often have a cough. They have a tightness. Sometimes they say it's like a band or a constriction. It's just hard to take a breath in. That noisy sound they may hear, wheezing. If it's quiet at night, they say, I thought I heard a cat, but it was me. That whistling and musical sound was coming from my chest. And then short of breath, you know, it's just hard to run because I can't catch my breath. Some people get a funny, like a tickle, and they find themselves scratching under their chin and that sort of thing. Wheeze, cough, chest tightness, and shortness of breath, those are the symptoms of asthma. And characteristic of asthma, they come and go. They're there today, they're gone tomorrow.
What is the relationship between asthma and allergies?
I think it's a close relationship between asthma and allergy because in children, and most asthma begins in children, I would say if you tested for an allergic sensitivity, you'd find it in 75 to 80% of children. They have an allergic tendency. And it's particularly allergy to things we breathe in. That makes sense, because if it's allergy of the bronchial tubes, if we're allergic to the cat or the dog and breathe in the danders from the cat and dog, that can set off an asthma attack. It's interesting, it's things that our immune system sends the defenses against, our antibodies, our immune cells, to fight off, to protect you, to defend you from things that are harmless. It's a mistake. Somehow in our evolution, the immune system got distracted. Instead of protecting us from things that are harmful, like parasites and worms and bacteria, now they defend us from harmless things, like dander of cats and dogs. You know, the dander, the stuff that comes off, the shed off the skin. And other funny things. Dust mites, so these little microscopic creatures that you can only see under the microscope, but they collect in mattresses and pillows and couches and stuff, dusty areas. And the human DNA makes, in some people with allergies, antibodies against parts of these dust mites. Harmless, unless you make an allergic reaction. And cockroaches and mold, those are some of the common things that for some reason, that's how our immune system has those are the things to which our immune system now is making allergic reactions. And if you happen to be one of those people whose immune system makes allergy proteins and cells to those things when they're inhaled, and if you inhale them, that's an allergic reaction in the bronchial tubes. Not everybody with asthma has allergies, but it's very common. They run together closely.
Can asthma be cured at all?
Is there any way that we can just make the asthma go away once and for all? And I think the answer is no. It's what we'd like. You know, the pill, the shot, like you get an antibiotic and your bronchitis went away, And do I have a pill and you never have asthma again? And I think the answer is no. Asthma is more like a chronic disease like high blood pressure or diabetes, that it is an ongoing, sometimes it goes away on its own. Many children had it as a very young child and then they outgrew it and it's gone. But for most people it just stays as a chronic condition, and there is no once and for all, come see the doctor, cured of asthma forever. What we can do is keep those bronchial tubes open, prevent the muscles from going into spasm, suppress the allergic inflammation and swelling and mucus, and you say, I can breathe fine. Thanks to these medicines that keep it under control, I can breathe fine. I can do everything. I can go to school every day. I can play sports. I can compete at the highest level because my asthma is controlled. My bronchial tubes are doing fine with the medicines that I need to take to keep them fine. But if you stop those medicines, I'm afraid the asthma is going to come back. We didn't cure it, we just kept it so it didn't bother you.
How and when do I use an asthma inhaler, and how does it work?
Well, that's a complicated story. And it's complicated because asthma inhalers have different types of medicines. It turns out that that makes sense, doesn't it? If you want to make the bronchial tubes better, a good way to get the medicine to them is to breathe them in. You don't have to take it as a pill or a shot. You just, and you put it onto the put the medicine onto the bronchial tubes, just as if you had a rash, you'd maybe just take a skin cream and rub it onto the skin. You wouldn't have to take a pill or a shot or something. And so to treat a disease of the bronchial tubes, really the best way is to get, in most instances, get that medicine onto the bronchial tube. So you need to inhale it. And so a number of different medicines are available in an inhaler. And some of the you could just imagine this. Some of the medicines are focused on relaxing that muscle, taking that tight snake that's squeezed down and getting it to relax and let the bronchial tubes open up, because it causes the muscles to relax and dilate, and now the tubes are able to be open again, the breathing tubes. And then other medicines, also breathed in an inhaler, are anti-inflammatory. They address the other part, the swelling, the mucus, the irritation, the inflammation, the allergic reaction in the bronchial tubes, and says, turn that off, like the cortisone cream for your poison ivy. Make that red swelling go away. Except we do it for the bronchial tubes, inhaled. So there are different medicines inhaled, and then there are different inhalers. The people who develop these medicines have put them in a series of different types of devices. The most common, you probably know, are the ones where when you squeeze it, psh, out comes a mist. And your job is to put it in your mouth. When you squeeze it, breathe it in, and distribute it over those bronchial tubes. And others come as a powder in the device, and the way you get it out is with the force of your own breath. So there's no spray coming out of the inhaler. It's the medicine is in the inhaler and you're pulling it in. And here's the one thing that's worth everybody remembering about whatever the inhaler, that you're trying to get the medicine onto the surface of thousands of breathing tubes throughout both lungs, way down deep, deep, deep in the center and outside the periphery of your lungs. And so it's no good going and having the medicine just hit on the back of the throat or the top. You need to breathe it in way down deep. And so all of these medicines work best if after it comes out of the inhaler or pulled out, it's a big, big, deep breath. People are asked to hold their breath a little bit so that the medicine can settle on the breathing tubes before it all comes out on exhalation. So the big, deep breath in and hold your breath for a little bit makes those medicines work so much better than if you squirt them on the back of your throat where it's not much help.
Um, personally, I'm going to college next year, and as everyone knows, college life can be stressful with grade, relationship, career choices, and many other aspects in the particular environment. Can stress affect a student who has asthma?
I think so. Stress makes everything worse. If you've got a stomach ache, your stomach feels worse. If you've got a backache, your back. If you've got a headache, it's going to be worse. I think it makes everything worse, and I think it makes asthma worse as well. For sure, if you can't breathe because your breathing tubes are swollen and narrow, and then you're kind of panicky or stressed or just, it's worse. It's just, and it's even in the way we talk about it. Oh my God, it took my breath away. I went in, I felt like I couldn't breathe. I had this exam or this relationship or this horrible thing happened to me. I couldn't breathe, And so it's not because all the bronchial tubes narrowed and got swollen. It's because, I don't know, the emotion, the stress.
Frustration.
We feel it here in our chest. And so if you have asthma, it's just going to make everything worse, right? The flip side of that, I think, many years ago, before your time, I think, people often blamed asthma on stress and emotions. They didn't understand all that we know now about what we talked about allergy, about the muscles, and all that was going on, the immune system reaction, the bronchial tubes. And they couldn't quite figure why some, these children, why are they getting these attacks that would come and go? And they blamed it on emotional upset and your relationship with your mother, and if you would just get your head cleared out, your asthma, And that's kind of blaming someone for the disease. It's not their fault, they have it. So I don't think asthma is due to stress or emotional relationships and stuff like that. But if you have asthma and you're stressed, it's just, everything's going to be worse and tighter. And the flip side of that, I suppose, if you're going through difficulty breathing with your asthma, the best thing to do is stay calm, if you can. Big, deep breath. Panic, it just makes everything worse. Stay calm. Slow, big, deep breaths. Make sure you get plenty of air. Don't, isn't going to help anybody, but work to take slow, deep breaths. Stay calm. Use your head. Make good decisions. Don't panic. Don't stress about it. That won't help a thing.
Is it safe to exercise with asthma?
It is safe to exercise with asthma, and I think one of the big take-home points that we try and share with people with asthma is that exercise is good for you. No reason to stay home and become a couch potato because exercise could bring on asthma. It is true. That's why people wonder about this. It is true that if you exercise, if you have asthma and you exercise very strongly, particularly when the air is cold, you may have noticed this, cold air and a lot of exercise with, because you're breathing hard with the exercise, that can cause the bronchial tubes to narrow. So now you're coughing and wheezing. But there's things you can do. You can use your medicines before you exercise, and then it didn't bother you so much. You can do a little exercise warm-up, and now the real strenuous exercise won't bother you as much. You can wear a scarf or some mask, and now when you breathe out, that warm, moist air that comes out of your lungs is caught there, and the next breath in will have some of that warm, moist air. It won't be the dry, cold air in it, so that won't bother you as much. So there are ways that allow you to exercise even if you have asthma. And a lot of people I've had with asthma say, I saw someone earlier today who just told me this, that when I'm in good shape, when I exercise regularly, that's when my asthma is the best. If I can stay fit, if I can exercise regularly, I think my asthma does the best. So we encourage people to exercise who have asthma, and if asthma symptoms are getting in their way, that's the time to go find their doctor or nurse or asthma educator and say, what can I do so I can exercise all that I want? Because we believe asthma shouldn't get in the way of being able to exercise all that you want.
If my friend has an asthma attack, how can I help my friend, or what should I do?
Well, I think you need to stay calm to help your friend stay calm, right?
Yeah.
So you can be a resource, and your calmness and cool-headedness, I think, will help. You can help them to try and take slow, deep breaths. Don't panic. Don't take quick breaths. If they have their medicines, you can remind them to take them, and you can make sure that when they take them, no, come on, do it again, but now breathe it deep. I know it's hard because you're having trouble breathing, but big, deep breath and hold it in. You can help them with their medicines. And then you can always get help, right? You've got that cell phone. You can get help. You can make calls for them. You stay with them and be there. I mean, that's for most any crisis. Having someone you trust and love near you and with you, that goes a long way to helping them through a crisis. So stay calm, help them with their medicines, help them get help if they need to get help, and stay with them while the help is coming. That, I think, is what you can do.
Do drinking alcohol, smoking, or using drugs affect asthma?
So you can imagine mainly it's the things you breathe in that are going to make it worse. I don't think alcohol will make asthma worse. It's a curious story. There's a small percentage of people with asthma, mostly older adult persons with asthma, who say, sometimes when I drink wine, my asthma gets worse. I notice that. But in general, wine won't, or alcoholic beverages won't bother asthma. But things that we breathe in, irritating smokes and chemicals, are likely to worsen asthma. Cigarette smoking plus asthma is a bad comment. It's a sort of a 1-2 punch. It's allergy to the bronchial tubes. It's chronic irritation, irritants and chemicals and poisons to the bronchial tubes. And cigarette smokers with asthma do worse than non-cigarette smokers with asthma. The medicines to treat asthma don't work as well in cigarette smokers as they do in non-smokers. So it's a bad combination. And then some drugs are really terrible chemical irritants to the bronchial tubes. So some of the illicit drugs are really poison for the bronchial tubes. So inhaled, a bad idea for the bronchial tubes. Swallowed, less likely to have an impact.
My final question is, where do you see asthma treatment going in the near future?
Well, I think there are a lot of exciting treatments coming along for asthma treatment. What's happened, I think, is that the medicines that we have now, if we can get them to the people who need them, there are a lot of barriers. Expense being one, and inner city struggles being another that we talked about. But if people can get the medicines and use them, and are willing to use them on a regular basis, most people do very well with their asthma. But some don't, even with modern asthma therapy. So where we're going right now is focusing on those people who, despite taking their medicines, good medicines that work for most people, they're still struggling. And what is it about that subgroup that just don't get better when everybody else seems to do just fine? And it turns out there's not one answer, but there are probably multiple different answers as one understands what's driving the resistant asthma in this person, and is it maybe different than what's driving it in this person and different. And so it's not one big soup, but it's little pieces of the pie. And now are being developed novel treatments that highlight this mechanism to severe asthma, or that attack this mechanism. And so we're coming up with different subgroups, better understanding of what causes it, and new treatments. Those are coming out this year, next year. There are many new and exciting therapies. And then the future, I think, maybe relates to what we were talking about earlier. If we can figure out what's making asthma so common, could we begin to think about prevention of asthma? What can we do early on, because it mostly develops in early childhood. What can we do for that susceptible child early on that's going to protect him or her from ever developing asthma? And I think that's the most exciting thing, and there's exciting research, we're not there yet, but novel ideas, and I think in the maybe not near future, but not too far future, we'll have good approaches to the primary prevention of asthma.
Thank you.
Thank you, Carissa.